Summer 2010, I went into atrial fibrillation, and I've never had any episode of that before, or even any indication that I had any heart issues. If I'd go, a year, maybe 6 months, no issues, and it would come back, and then it started to come back with more frequency and more severity, and the further along it progressed, the more difficult it became to manage.
So John's underlying cardiac abnormality was one of thickening of the heart muscle to the point where it doesn't relax very well. And so he has what we call restrictive cardiomyopathy. His circulation had got to such a poor level that his kidneys began to deteriorate, and we ultimately had to put him onto a temporary device called a balloon pump to help move blood around his body. Unfortunately, not something that he could go home with. We evaluated him for transplant candidacy, both for heart and kidney transplantation.
At some point you start to think about, if this is how I end, then, what happens to them as they move on? Who walks my daughters down the aisle when they get married? Who looks after my wife? Who takes care of the things that I've always taken care of?
As an advanced heart failure doctor, I deal with patients who are routinely sort of at the end of their rope when it comes to their cardiac condition. Some of the toughest patients to take care of are those who are young, who are young fathers like John was. He was willing to do just about anything and everything if it meant to be able to go home to his family.
He was motivated, again, to get up and move around. He was sitting in the chair within 2 days and looked as if he didn't go through all this. He looked really good.
Well, John is doing excellent right now. John has been free from any form of rejection so far, going on almost 4 months now. He's loving life, and he's telling me that he feels better now than he has in a decade.
I think I'd gotten to the point where I didn't know what it felt like to feel good anymore. Good was just a relative standard of lousy. I feel like I'm ready to go back to work. I feel like I'm ready to start amping up the physical activity a little bit.
Overall, he's doing fabulous, and we're happy to see him home and not in a hospital and enjoying some time with his family.
It's comforting to know that you're in the hands of good people that are sure of what they're doing, and just support from everybody. I'm under the understanding that the heart and the kidney are from both the same donor. I'm grateful for the donors, and I'm grateful for the donors' families. It's all about, what am I going to do with this second chance? What am I going to do with the time I've been given? How can I be more productive? How can I help somebody? How can I maybe make the world a little bit better place?